look good and feel great during your pregnancy and prepare yourself for your labor. Hi, my name is Christy Shields. I'm 25 weeks pregnant, well into my second trimester, approaching that third trimester. For our workout today, ladies, you're going to need a stability ball, also known as a fitness ball, some light hand weights, 2 to 3 pound hand weights. I'll be using 3 pounds today, but do what feels comfortable for you. A wall close by for one of our exercises, and also a mat or a carpeted surface. Now, a couple things to make note that you're well into your second trimester, that you may be experiencing at this time is some of that round ligament pain, which, you know, can be very uncomfortable at times. So just keep this workout today at your pace, and if there's, I'll be giving you various modifications and variations to do that particular exercise, so do what feels comfortable for you. Also, some of you may be experiencing, when you're lying flat on your back with your face up, some trouble with dizziness or lightheadedness or shortness of breath. Just make sure if you feel that way, you roll to your side immediately and kind of get on your side, or come to a seated position and just kind of avoid that exercise. All right, we're going to go ahead and get started. We're going to start with those arms down by your side. Draw your belly button in and up, and by sitting on the stability ball, really put your spine in a nice neutral spine, which we're still trying to work on that position in our second trimester here. Turning your palms face up. I want you to inhale as you reach those arms up overhead, bending your elbows. Exhale as you release those arms down by your side. Really focus on that breath. And if you feel nice and stable on your ball right now, really try to connect that mind and body by closing your eyes here, and inhale as you extend those arms up overhead, and using your exhale, release those arms down by your side. Let's do 2 more with those eyes closed. Inhale as you reach those arms up overhead, and as you exhale, bending those elbows, releasing those arms down by your side. Last one. Really feeling the energy move through your body as you reach those arms up overhead, and taking that nice exhale to release all the stress that you have had maybe today. Opening those eyes back up. Stay seated on your ball. We're going to grab our hand weights and kind of warm up that upper body, as well as start to initiate some movement of our pelvic floor. I'm going to start by just bringing one heel in front, and then you're going to do a slight bounce, reaching up toward the ceiling. So you're going to extend your arms out, and then you're going to reach up, making sure your thumbs are up, holding those hand weights. And again, you're going to extend one heel out. You're going to exhale as you lift. Inhale as you lift your heel. Exhale as you go to that slight bounce. So this slight bounce helps kind of initiate some movement of the pelvic floor, also helps strengthen the core muscles. We're warming up that upper body and starting to strengthen that upper body, which you need good upper body strength to help hold that baby once that little one arrives. Good, we're going to keep this up for about a minute here, ladies, so you may start to get a little breathless, getting that heart rate up, getting circulation moving. Again, don't forget about your breath. One of the most important things here, you want to inhale and exhale. Inhale. And that lift doesn't have to be too high off that ball. Nice job, ladies. Let's do 2 more on each side. Last one. Nice job, and we'll release those hand weights down by our side. All right, ladies, so we're going to grab our ball and go ahead and stand up. And you're going to place that ball up against a wall, and I want you to have those hands positioned at shoulder height or below. You're going to walk your heels back to keep your heels firmly planted on the floor. I want you to exhale as you bend those elbows in, tucking your tailbone under, draw your belly button in up, and inhale as you press those arms and extend them all the way out. Exhale as you bend in, inhale as you extend. So wall push-ups are a great way to strengthen the upper body, strengthen your core muscles, as well as stabilize your shoulder blades, learn how to stabilize those scapulas. Again, exhale as you bend, inhale as you extend those arms. Also getting a nice stretch to the back of the legs, making sure you're pressing those heels down. Inhale as you come out. Don't forget about tucking your tailbone under and drawing your belly button in and up. to let those elbows brush your side. Let's do 3 more. Exhale, inhale, last 2. You got it. And we'll release that ball from the wall. And go ahead and set that ball off to the side.
Okay. We are rolling and action.
All right, so we're going to continue with some upper body strengthening. I'm doing some lat pull downs. So I want you to grab your 2 to 3 pound hand weights. We're going to come into a tall kneeling position. And I'm going to face sideways, ladies, just so you can kind of see where the position of my pelvis will be, as well as the position of the arms. So we're going to go ahead and start with those arms down by your side. Roll your shoulders back and down your back, connecting your shoulder blades together. I want you to take a nice inhale, and as you exhale, I want you to tuck your tailbone under, kind of engage those glutes, and draw yourself more to a neutral spine. In our second trimester, well into the second trimester, you'll notice as your baby bump gets bigger that your pelvis wants to tip more forward, which is very normal and natural for the birthing process. But right now, in order to help with any back pain, we want to kind of still try to focus on that neutral spine. So you're going to, again, tuck your tailbone under and engage those glutes. Stack your shoulders right over your knees. You're going to reach those arms up to your side, and I want you to keep those hands a little bit in front of you. You're going to bring your palms so they face each other. I want you to inhale as you extend and exhale as you lower. And as you lower, I want you to really think about drawing your shoulder blades down to your back pocket. Exhale as you lower. Inhale as you extend those arms up overhead. Now if you feel anything in the neck position that maybe your weights are a little too heavy, so either lighten the weights or you can do one arm at a time if that feels a little better to you. Again, this upper body strengthening work is so important for after that little bundle of joy arrives, that you are able to carry them around as much as you're going to be. Again, inhale as you come up, exhale as you lower. And drawing that belly button in, tipping your tailbone down toward the mat. Let's finish out with 5 more. And last one. Nice. We'll release those hand weights down by your side. And we're going to slowly come back up to a standing position. So we're going to come down to the floor, placing our hip closest to the ball, into the ball, pressing that into the ball. You're going to interlace your fingers and place those opposite hands behind your head with your lower elbow supported on the ball. And if you feel like you need more balance, just use that top hand and release it and put it on the ball in front of you. We're going to come into a little bit of glute work, side leg work, into a nice stretch through those intercostal muscles. So we're going to start by lifting that top leg, giving yourself a nice straight line. So try to look straight ahead, don't look down at the floor. You're going to flex that foot and you're going to point your toes as you bring it back behind you. I want you to inhale forward and exhale back. It's not a very big movement. The smaller the movement, actually the better. So we isolate those muscles, really work also on strengthening those obliques. Again, inhale 2 forward, exhale 2 back. Nice. We'll do a couple more here. And slowly bring that leg back to the center and lower that leg down. You're going to take that bottom leg down to the floor. Now for your stretch, you can stay here with this bottom knee bend. If you want to challenge those obliques a little bit more, you're just going to take that back foot and come to a nice stability exercise, strengthening the obliques, strengthening your torso. And you're going to bring one foot in front of the other and make sure that head and neck are supported. So whichever, if you want to keep it supported on the ball or with that hand, you want to reach your top hand overhead, pulling that top hand, drawing your shoulder back out of your ear. You're just going to hold this stretch. Now I want you to take 3 or 4 nice deep breaths in through the nose and exhale out your mouth. As you do that, I want you to really feel those intercostal muscles between those ribs getting a nice stretch, because as your baby bump is expanding here, those muscles are starting to get really tight. And if you want to kind of avoid some of that shortness of breath in the latter part of your pregnancy, it's very important to stretch these muscles now. Inhale and exhale. Again, inhale. And on the last one, closing your eyes if you feel you're nice and stable. And just really feel everything release. Opening those eyes, bring the arm back down by your side, slowly drop that bottom knee, sit yourself back up tall, and we're going to switch and do the same thing on the opposite side. Again, positioning that ball where that hip closest to the ball is pressed into the ball. You're going to drop that bottom hand, make sure you're in a nice straight line. You're going to lift that top leg again, bring that opposite hand behind your head so you can open up your chest muscles or place it in front if you need it for balance. We're going to inhale that foot as you flex it forward, and as you point your toes back, you're going to exhale. So inhale 2. And again, just making sure, breathing is so important during your pregnancy. We're really starting to think about our labor right now, and just that breath really can help calm the body and help make that baby feel a little bit better, but also help you during your pregnancy stay a little bit less stressed. Especially when we're starting to get in closer to this last trimester, things start to get really uncomfortable, so really practicing that breathing is so good. Again, inhale forward, exhale back. Very common to have one side not quite feel as strong as the other side. You may be sleeping on one side versus another right now. I'm sure you're spending a lot of time sleeping on your side. So if one side feels a little tighter and you need to drop that leg a little bit. Last one. That's okay. Slowly setting that foot down to the floor, taking that top foot in front. And again, if you want to stay here for your stretch, it's quite all right to keep this knee down on the floor and keep yourself supported, and just give yourself a nice deep stretch. If you want to increase the challenge and really work on strengthening those obliques, and you feel nice and balanced and stable on that ball, then I want you to bring one foot, your bottom foot behind the front leg. Again, you're going to support that head and neck. You're going to reach that top arm up and over, drawing your shoulder out of your ear, giving yourself a nice straight line. When you're in this position, again, we want to focus on that breath and opening up those muscles between your ribs. Inhale, and take a nice exhale. Again, inhale through the nose, and exhale out through the mouth. 2 more breaths. With each breath, feeling yourself relax a little bit more into this stretch. And on that last one, again, if you can, close your eyes and really connect your mind with your body. And release it out. Releasing that arm down by your side, opening up those eyes again, dropping that bottom knee, and bringing yourself back up to a tall kneeling position. Great job, ladies. We're going to come back up to a standing position. We're going to start in a Pilates V stance, which means heels together, turning your toes out, opening up those hips, opening up that pelvis a little bit. You're going to start with those hands by your side, pressing those elbows into your hips, but keeping your palms up, holding on to your light hand weights. I want you to draw your belly button and lengthen your spine, stacking your shoulders directly over your hips. And we're going to take that right leg and we're going to step out to the side and squat with an exhale. And you're going to inhale as you come back to the center. Exhale as you open up. Inhale back to center. Exhale, open. Inhale as you come back up. Each time you come back up, draw your belly button in and tuck that tailbone under and reset and really think about that pelvic floor. 2 more. And then we're going to go to the other side. So you're going to step out the same thing to the other side and always come back to that Pilates V stance. As you're stepping your leg out, your thumbs are going out, just not letting those arms or those wrists go past your elbows. One more, and then we're going to take it back to the right for 4. Exhale over, inhale and lift. Exhale over. 2, 1. Back to the left. Nice, shaking that baby up a little bit here with all our movement. And we're going to go right and left now for our last 16 counts. Exhale as you lower, inhale as you come back up. Always remember to reset, tipping that tailbone down. One more to each side. And bring it back to the center, releasing those arms. Inhale and exhale, release it out. Bringing those feet back together, we'll release those hand weights down to the floor. Coming down to the floor, you're going to have a seat on the mat, sitting back on your heels, but still trying to sit up nice and tall. Or if you want to, you can also sit cross-legged position with a pillow underneath of your butt if you need to support you up a little higher. I'm going to sit in this position. I want you to take your non-working hand and place it on the ball just for some support. Your working hand, you're going to grab your 2 to 3 pound hand weight, and you're just going to take that wrist and extend it directly above your elbow. Again, pulling that belly button in, tipping your tailbone down, and inhale as you lower back to the starting position. So exhale as you lift, inhale as you lower. Great exercise here to help strengthen those deep rotator muscles of your shoulder. Exhale as you lift, inhale as you lower. Just be careful with the position of your wrist. Try not to let the wrist bend. Try to keep it real nice and straight as you're holding on to that weight. And if you feel any tension, feel any uncomfortable is okay, but pain is not in that shoulder. So if you're feeling any pain with this movement, go ahead and take it down, and you can also take it in and out here. That is your modification or variation. Last 2. And last 1. We'll switch to the other side. Just bring that ball to the other side, holding that hand on the ball for support, taking that opposite wrist in line with your elbow, elbow in line with the shoulder. Exhale as you lift, inhale as you lower. Drawing your belly button in, tuck your tailbone under. Looking straight ahead, don't look down at the floor. Imagine as if you're taking that hand up and going to wave at somebody out in front of you. Two more. And last 1. And to finish out our arm strengthening exercise, we're going to come right to triceps. So we're going to just move that ball off to the side, grabbing your hand weights. I'm going to, again, face my side so you can see the position of my pelvis as well as my hands. You're going to roll those shoulders back and down your back, connecting your shoulder blades together, tucking your tailbone under, engaging those glutes slightly, drawing your belly button in. You're going to start with those elbows bent behind you, and try not to curl those thumbs around the wrists. Try to keep those hands nice and straight, and you're just going to press back to straight arms. Exhale as you press back. Again, looking up straight ahead. Try not to look down at the floor. Really tucking that tailbone under. Last 2, and then we're going to change the position of our hand. We're bringing our pinkies back and our thumbs down and continuing to bend and straighten the elbow. And again, making sure that you tuck your tailbone under, draw your belly button in, look straight ahead, don't look down. This arm strengthening workout, again, is so good to help strengthen that upper body. Swell those arms and to open up and stretch those chest muscles. Last 2, and last 1, and releasing those weights down by your side. We'll set them off to the floor, and we're going to come back up. All right, ladies, so we're going to come back into standing. I want you to take that ball, holding on to it, reach down in front of you. We're going to step back with our right foot. You're going to bend that back knee slightly, and you're going to tuck your tailbone under and drop that back knee toward the floor. So this is a nice psoas stretch. You can stay here, Or you can come with me and we're going to add a little movement to this exercise. So you're going to drop down into that stretch and then draw that knee up towards your ball. Now depending how well balanced you feel at this point in your pregnancy, you may not want to lift that foot off the floor, and that's okay. So you can also take it just to going straight down and straight up and do what feels comfortable for you. We're going to count down from 10 here. Making sure, ladies, that you always try to reset that pelvis when you come back down. So dropping that back knee, you want to tuck the tailbone under, lower back down, and then exhale as you lift the knee. Tuck the tailbone, lower, and lift. That little extra movement is so important to kind of give yourself an extra stretch. Let's do 3 more. And 2. And last one. Nice. Standing up tall, we're going to switch sides. So stepping back with your left foot this time. Again, you want to probably lift that left hip just a little bit. Bend that back knee. Tuck your tailbone under. Engage those glutes. Still holding that ball out in front of you. You're going to hold this stretch for a bit. And if you want to, stay here in this stretch. Otherwise, you're going to add that knee and bend that back knee and lift that knee towards your ball, adding a little abdominal strengthening work. Also challenging that balance a little bit. And again, on this side, if bringing that leg up, or sometimes, one side doesn't feel as good as the other side, just stay here and take it down and up. Just make sure that you're always resetting, tucking that tailbone under you, and pulling that belly button in. All right, ladies, we're going to count it out to 10, otherwise from here. Lower, exhale, lift. Lower. Nice job. Again, just remembering to tuck your tailbone, drop that back knee, lifting that knee with your exhale. It's 3 more. 2. And last one. And setting that foot down, release that ball. I'm sure those arms are tired too. Set that ball back down on the floor. All right, ladies, so we're going to come back and have a seat on our ball. We're going to go right to a roll down, kind of like a pelvic tilt movement to a jack. I'm going to give you a variation to this movement as well. And I want you to exhale as you kind of tuck that tailbone underneath of you. Excuse me. I want you to exhale as you tuck that tailbone underneath of you. And inhale as you lengthen your spine back up tall, and you're going to do a small little jack. Now, if you want to, you're just going to do a single jack, stepping one foot out to the side. Again, I'll show that version, and come back to the center. So again, you're going to exhale as you hollow through those abs, rolling down, giving your back a nice stretch. Inhale as you lengthen your spine, and exhale as you do your jack. We'll speed this up in a little bit, but I just want to make sure that you have whatever variation feels comfortable for you. And as we are well into our second trimester, ladies, you'll notice that as your baby bump gets a little bigger, sometimes with that pelvis tilting forward, it can cause a lot of strain on that low back. So this is a great exercise here to kind of give your back a little bit of a stretch and help you give you some relief. All right, I'm going to speed it up now, and you can go at whatever pace is comfortable for you. Again, exhale as you inhale, exhale, exhale, inhale, exhale. Nice job. So again, this also, we want to kind of get your blood flowing and get your heart rate up a little bit. And this ball, this little bounce on the ball is great for initiating movement in your pelvic floor, which is really important during pregnancy to prepare yourself for your labor. Got it, ladies. We're going to count down. We're going to do 10 more. Exhale, inhale. Nice job. Again, just to make sure, if anything feels uncomfortable, you can always just stop and do some nice hip circles on your ball. Those hip circles are great to help position your baby a little better if you're having a little bit of pain, tailbone pain, or round ligament pain, maybe that little hop ain't feeling so great today. Nice job, last couple. And let's finish it out here. Nice job releasing those arms down by your side. We'll go ahead and stand up. All right, ladies, so we're gonna finish our workout today with some nice, easy stretching. We're gonna start with some thigh stretches. I want you to position yourself where you're sitting back on your heels again. You position that ball right back behind you. And from here, you're just gonna tuck your tailbone under and peel your glutes off the mat. And if you can stretch those shoulders all the way back on that ball. And lift, and take a nice deep breath here. Inhale, and exhale. And then if you need to release it out, you just sit yourself back down on those heels. Otherwise, you can stay up in the stretch and just, it feels so good just to really open up those chest muscles and really tuck that tailbone and lift up here and feel a good stretch through those hip flexor muscles. That gets so tight right now as your pelvis is tipping forward. Nice stretch to those abdominals. Gives you a good chance to just really connect with your baby here. And holding on to that baby bump and talk to your baby as you're breathing. And the last breath. And slowly release, sitting back on the heels, and release yourself out. From here, we're going to go ahead and just come up to sitting on top of your ball. We're going to go into a nice hamstring stretch. You know those hamstrings get very tight. It's a great stretch for that back right now. So you want to separate those feet in a V. Sitting up on the ball, you want to hinge your body forward, placing your hands on your thighs or on the ball. Pull your shoulders back and down your back, and you're just going to hold this stretch. You're going to take 3 or 4 nice deep breaths again. Really tucking that tailbone under, pointing your toes closer towards your face. And last breath. And then rolling your pelvis forward, stacking your shoulders back over your hips. And if you're close to that wall, grab onto that wall. You're just going to take your right ankle, cross it above the opposite knee. You're going to hinge your body forward, taking your non-working hand or the hand that's not supported against the wall, and place it on your hip. And just kind of hinge yourself forward and feel a nice stretch to those glute muscles. Again, 3 or 4 nice deep breaths in through the nose. Exhale out the mouth. And very common again in this stretch, depending on which side you're sleeping on more right now, to be tighter on one side than another. So make sure the side that you feel a little bit tighter on, that you stay on that side a little bit longer. And this is definitely my tighter side. So inhale and exhale. Again, drawing that belly in, sticking your tailbone down. Sitting up nice and tall. As you hinge your body forward. We'll take a couple more breaths. And then if you need to switch sides and go stretch the other side one more time or stay here, you definitely should do that. Make sure you're nice and stretched out before we end today. And rolling forward, release that foot comfortably to the floor. And hopefully you enjoyed your workout today. Have a great day today, ladies.